Hello there. Thank you for joining CCN, Connect Care Network. This is Consumers Doctor, Dr. Bengala. I've been listening to the Amy Coney Barrett Supreme Court nomination. You know, I keep looking at these representatives arguing against her. The main reason being Affordable Care Act. Today, I'm going to talk about Affordable Care Act in comparison to the guaranteed health coverage for all Americans. What are the pros and cons of Affordable Care Act? As you all know, there are three pillars in healthcare delivery. Choice. In Affordable Care Act, there's no choice, folks. You cannot choose your doctor, you cannot choose your hospital, you cannot choose your network of doctors and providers. There's no choice. Come on, let's come to the senses. There's no choice. Cost is it is not cheap. Affordable Care Act is not cheap. It's a government mandated. Obviously, it's going to be cost prohibitive. And what is the care? There are three pillars: choice, cost, and care. You're not getting the best care, folks. You will not get the best care because you have no choice. As simple as that. Let's talk about it. What are the alternatives? Affordable Care Act is nothing to do with healthcare. As you all know, it's all politics. You know, I'm a Democrat, okay? I'm a Kennedy Democrat, became a Reagan Democrat, embraced the Reaganism in 1980s. So now I look at what the Democrats versus Republicans comparison. You know, Democrats literally want to trap these Americans in the lower socioeconomic status so they can just keep voting. It's called vote bank politics. Trap them, like you know what they did to the African Americans. They literally destroyed the whole race. Lyndon Johnson, 1960s, by Welfare Act, so-called welfare. They destroyed the entire black race by having this welfare system. Otherwise, the Republican Party was originally embraced by the blacks. When they saw this, to entice the blacks into the thing, they started this social justice, so-called welfare reform, welfare act. What it did to the African Americans is unforgivable. They basically, I'm looking more and more, you know, the Democrats want to keep the people in the lower economics so they can keep voting for the Democrats, where Republicans want to embrace the idea of empowering the Americans, where they climb up the ladder, they can be Republicans. So there is always always a friction between Democrats and Republicans wants to empower the consumers, raise the economic status, so where they can vote Republican. So this is simple, folks. So the Affordable Care Act, you know, if they think if Amy Coney Barrett becomes a Supreme Court justice, what will happen? They seem to think the Democrats' argument is, oh, we're going to lose the health care. We're going to lose you know, all these benefits are going to be gone and people are going to suffer. Come on, it's not going to happen. There is a choice, folks. There's a thing called guaranteed coverage. President of the United States can empower Americans to have a guarantee. He can issue a certificate by just executive order. You don't need a Congress. Executive orders, just certificate of guaranteed coverage through public and private partnership. What it happens, the public and private partnership will have a health review authority, will give you the certificate of guaranteed coverage, where consumers like you and me can choose the healthcare plan you want, healthcare insurance you want. You can choose your doctor, you can choose your hospital, you can choose all the providers, where everybody's empowered in this health review authority, where once they issue a certificate of guaranteed coverage, insurance companies have to provide the coverage. And we already have Medicaid. Medicare does provide health care. What it is lacking is a lot of providers don't want to take Medicare because of lower payments. What I see is like a EBT cards, electronic benefit card. Give them the incentives. America should invest in Americans. Instead of wasting $10,000 per person on the entire spectrum of $3.7 trillion come to $10,000 per person. That money could be invested, especially in the lower economic status. People who can't afford, uninsurable, handicapped, again, disabled, veterans, you name it. They can invest, and they can also provide incentives so they can climb up the ladder, folks. They can climb up the economic ladder. This is what the empowerment is all about. Let's look at the alternatives. As Abraham Lincoln said, America can never be invaded from outside. It can be if you falter on freedom. This is one of those things, folks. Healthcare is a freedom. You can mandate everybody should have a healthcare, but how you do it is very critical. By empowering the consumers. Instead of empowering the insurance companies, give the authority to the consumers, folks. Consumers, even people who are on low socioeconomic ladder, give them the tools what they need. Give them the tools, incentivize them to save money. If they choose a doctor, they can choose basing on their affordability. They can choose the hospital basing on their. Give them the tools what they need. Let them make a choice. Empower them. Let's compare with auto insurance. Auto insurance. We have so much of freedom in picking and choosing what coverage we want. What is the difference between auto insurance and health insurance? I don't see any difference. We should be able to get the same coverage like we have in health insurance. It should be competitive. It should be across the state line. You can get the best coverage, and you can choose your plan. Choose everything what you need. If you are healthy, your premiums have to be lower. If you are not insurable, they will be reviewed by the Health Review Authority, which is a public-private partnership. They will give you a certificate of guaranteed coverage, and the insurance companies have to participate. Folks, they will. Once the government guarantees the coverage, they will participate. That gives them the freedom to the consumers. There's a consumer-driven healthcare reform. It's Affordable Care Act is misnomer. It is not. You don't have any choice, and you don't have any say in it, whereas the alternative of guaranteed coverage by the President, by the Senate, by the Congress, gives them the tool what you need to empower the folks so they can choose what they want. Again, 3 pillars. If you want to have the choice, guaranteed health coverage through public-private partnership gives you the choice. And cost. It costs less because, consumers always typical, any other industry, they want to save money. You're empowering them to save money. Let's do that, empower them to save money. So what will happen is it will drive the cost down. And number three, care. Healthcare is the best healthcare you can provide in the public-private partnership. You will have the best care at a lower cost. I just was talking to my friend of mine who's a cardiac surgeon. He just told me, if you have a transfemoral valve, you can have a valve done. You can have the heart valve replaced to a transfemoral approach without the surgery. The product, what you place through a transfemoral through the groin, it is $50,000, folks. $50,000. This cardiac surgeon was saying, the product, how do you pay for it? And if you open and do the surgery, the same product by doing surgery is $5,000. Folks, this is simple. Everybody is trying to rip the healthcare. You name it. I'm not blaming anybody. Once you have, is the consumers are in the driver's seat. Let the consumers decide. Would you go for a $5,000 procedure, or would you go for $50,000? This is simple fact, for consumers want to save money. Give them the power, the tool they need, so that way they can take care of their own health. You know, we have a problem with obesity. Why do you think there is a obesity problem in the Western Hemisphere, especially in the United States? Because there's no personal responsibility. I see people in the lower socioeconomic status, they're not worried about what they eat. They are worried about day to day. Their depression and all those things, they end up consuming the wrong food. By giving personal responsibility, they will take care of their health, their premiums will be lower, they get to see the best doctor. So giving a choice to the consumers makes sense, folks. Let's talk about public-private partnership in healthcare delivery. I'll be talking about this healthcare. If you do like this channel, it's a CCN channel. Subscribe to the channel, hit the notification button, and again, I can talk about different procedures and different incentives for the consumers. How do you embolden or empower the consumers in what way? And you can shop for the best lower premium like auto insurance. I can guess the best auto coverage. Why can't I get it in the healthcare? Why? Tell me why. It just doesn't make sense, folks. Healthcare is like an auto insurance. There has to be more complex. I don't like this hospitals consolidation, group consolidation, taking away the free enterprise, folks. That doesn't work. So-called non-profit hospitals are ripping the system off, pharma ripping the system off, because they see the loophole, because insurance companies are not helping us. Let's have the consumers take charge and get up with the best option for the consumers. If you do like it, we'll see you in the next episode. Let's keep talking about CCN networks. And I'm a consumer's doctor. Folks, I'm retired. I'm on your side, folks. I'm a consumer like you are. I've been in healthcare for the last 40 years. I know what is good for the consumer. Let's do it, folks. Join me in my next episode. Thank you for joining me. And make some comments. I'd like to reply to the comment. Thank you.